This presentation will explore how the Affordable Care Act, or ACA, will affect those practicing or one day intending to practice in the field of complementary and alternative medicine, or CAM. The specific question we're seeking to address is how the ACA will affect the CAM job market, a question of particular concern for Ashford students majoring in programs within the Department of Health. To answer this question, we need to take a look at the ACA language itself, in particular, a section that will expand some CAM practitioners' ability to be covered by insurance. Getting CAM services covered by insurance is essential to expanding access to CAM, as most services are now paid for out of pocket by consumers. By expanding coverage for CAM services, the CAM provider job market is expected to expand in kind. Let's take a closer look at the ACA to determine how this will happen. Section 2706 of the ACA is a provider non-discrimination provision. This provision will apply across all categories of providers. It will prevent insurers from routinely discriminating against entire classes of healthcare providers, including complementary and alternative medicine providers. This provision will apply to group health plans and health insurers offering group or individual health insurance coverage, which could include any of the following: self-insured employee health benefit plans, group health insurance, individual health insurance, and plans participating in health insurance exchanges. In other words, this non-discrimination language will restrict health insurance companies from discriminating against any healthcare provider, whether they are a medical doctor or a CAM practitioner, so long as they are acting within the scope of the applicable state license or state law. It is important to note that this non-discrimination language does not explicitly require insurance coverage of complementary and alternative therapies. To determine if the CAM service is covered, there are two qualifications, both of which must be met. First, if the service is already included in the insurance coverage for other types of providers, then the service should be covered by insurance. Second, if the service is within the scope of practice by a licensed CAM provider, then that provider should be covered by insurance. Let's look at a common procedure like a pap smear as an example. If an insurance policy covers a pap smear by an MD, then any provider licensed to provide that service should also be covered according to the ACA. In the state of California, this could include insurance coverage for CAM providers such as naturopathic physicians or licensed midwives. This provision does not require coverage of a previously uncovered service, regardless of who provides the service, nor does it require a plan to contract with any willing provider. Insurers will also have the option of restricting the number of providers of a given specialty in their medical panel. Additionally, the provision cannot prevent the establishment of varying reimbursement rates based on quality or performance measures. So when will this provision in the ACA be implemented? Well, technically, the non-discrimination provision goes into effect at the beginning of the applicable plan year on or after January 1st of 2014. But wait, why hasn't that gone into effect yet? Well, for better or worse, each state is implementing the ACA as they see fit. In California, for example, this provision is not yet being enforced. But there is a bill being introduced by State Assembly Member Ed Chow, AB 2015, Non-Provider Discrimination, which would prohibit a healthcare service plan or health insurer from discriminating against any healthcare provider who is acting within the scope of that provider's license or certification, thus enforcing ACA Section 2706. Whether you're a student who hopes to enter the field of complementary and alternative medicine, a patient of the medicine, or just an advocate of increasing access to holistic healthcare, contact your legislator on a local and state level to find out what they're doing to enforce this non-discrimination provision of the Affordable Care Act. And for your reference, here are the two laws that we discussed.